Thank you all for coming. My name's Emlyn with Brave Communities. And so BRAVE is an acronym for Building Relationships, Awareness, Voices, and Engagement. And so we host monthly community conversations. This is our first virtual one. And so today we wanted to talk about obviously the COVID-19 and the global pandemic, and speaking with some of our community champions that are addressing and kind of being the frontline responders to health and medical needs, whether they are the actual medical professionals and or administrators. And we also have Mariam, who's a student studying to be a pre-med major, and she's also Brave Communities intern. So I'm just gonna let the panelists introduce themselves and then kind of share like your background and your service to the community during this time. Let me start with Tasha.
Yes, I should unmute myself first. So my name is Dr. LaTashia Kiel. I am a nursing school professor at the University of Texas at Austin. And so we obviously work with a lot of the community hospitals through our students and the work that we do through the school. I'm also a house supervisor for the network for Ascension family of hospitals. So we have 12 hospitals that service our area. And so as a house supervisor, we basically deal with all of the movement in between and within our facilities. Throughout this coronavirus pandemic, we have taken over all of the placements and movement at the hospitals because we're essentially running in disaster mode and preparation at this time. I'm an emergency nurse, so I've been doing that now for probably about 10 years. I initially worked at the trauma center downtown, what was what we now call Seton Medical Center. However, in the most recently, I've spent a lot of time at Seton Medical Center Williamson. And I have a nonprofit called the Kiel Colon Cancer Foundation that I run, me and my husband run, and we do a lot of education, awareness initiatives in the community. A lot of, I guess on the bigger stage, we are working with a lot of the organizations in DC to kind of help policymakers come up with different policies for issues that are important to our community.
And she is also a full-time mama of one beautiful daughter and expecting a second one soon. I want to see the baby bump.
I don't know that you can really see it's like it has its day. So yesterday was a big day. Today is not so much.
Okay. How about?
Here she is. Say hi.
Here's Ginny.
The joys of working from home.
Thank you, Tasha. Okay, let's move on to, I'm just going in my order. I don't know if everyone's in the same order, but Sandeep?
Yes. Hi, my name is Dr. Sandeepkumar Singh. I work with, I'm an ER physician by trade. I work with VA, Temple, and also I work with Austin Emergency Center. I'm a partner and a medical director at Mueller. We have 4 locations: South Lamar, Anderson Mill, Far West, and Mueller. And we have recently started our CASA, that is a car-side symptom assessment center for COVID-19. So we evaluate patient over there and we test for COVID if needed over there. I've been involved with a lot of community activities as well as the business entrepreneurship, and I'm very interested in equity and social reform. So I'm here to share my point of view as a frontline guy in the emergency medicine, as an ER physician, what we are seeing and what we should be doing.
Great. Thank you so much, Dr. Singh. And Selena?
My name's Selena. I am president of the Austin EMS Association. So I am a paramedic for Austin, as well as a nurse in our surgical ICU at Seton, where LaTashia is a house soup.
And I see, and right now, I think the Austin EMS is doing so much distributing, I mean, not only serving front end, but also serving to the homeless communities and things like that. Is that correct?
Because our medics are probably the city employees that interface with our people experiencing homelessness, we definitely get to hear what's going on in those communities before it reaches a lot of city council members, and oftentimes we're a conduit to share what's going on with our city council members. Even before COVID, there was a hotel that housed a lot of people that are on the edge of being displaced, you know, the weekly hotels, and they were actually going to kick out, evict all of their residents. That would create upwards of 200 people who are now homeless. And so we're able to alert them when we hear about these type of things, and they can take action. And so when the whole city shut down, when all the restaurants closed, all the food pantries, all the service providers basically disappeared off the streets. Because we're paramedics, we have the PPE. A lot of our service providers did not have the PPE, and so we still see integral care is not really out in the communities. And so our community health paramedics, we're continuing to be out there. Our medics continue to work every day with people who are experiencing homelessness, and we found out very quickly how desperate the scene was downtown. And the city is a very large institution and very hard to get these processes in place. And so I was talking to Pooja, and I was just complaining to her about what we're seeing in the field, and she and a group of women jumped in to start providing food that then they give to our paramedics, who then distribute out downtown. And so the city has tried to correct it, but we're already seeing issues. So we have a lot of work ahead of us as well.
Great. Well, thank you for your service. And Perla?
Hi, everybody. So happy to be on this panel and hoping to provide helpful information to our partners and community members. My name is Perla, and I'm the Deputy Director at Central Health. Central Health is the Travis County Healthcare District, approved by voters, funded with taxpayer dollars. Our our 9-member board of managers is appointed by City Council and Commissioners Court. The Travis County Commissioners Court also approves our budget. Really, our mission is, by caring for those who need it most, Central Health improves the health of our community. We are focused on serving individuals who are low income or uninsured. We are an enterprise that includes community care health centers throughout Travis County. It's the largest, sometimes second largest system of community health centers in Texas. I think Houston, the legacy community health centers is, we're about that level of Houston's, of Harris County's health center network. We also have a health plan, Sendero Health Plan, which is our nonprofit community-based health insurance company that's on the ACA Healthcare Exchange. And really, in terms of our role during this, pandemic, we've been closely following the development of the coronavirus in our community. The impact of the coronavirus in our community. We've been working very closely with Austin Public Health and the Emergency Operations Center. Community Care Health Center is our, point of contact at the EOC. And really, we've been working a lot. We've been busy trying to adapt to this new normal of providing healthcare services, and just also trying to stay on top of all the day-to-day, evolving news, impacts, changes, system changes. I think we also, I want to just also say that we've set up a COVID hotline for individuals who are uninsured and don't have an established provider. It's 512-978-8775. I think we're taking about 250 calls per day. And even though we're encouraging people who are uninsured and don't have an established provider, who have symptoms, to call that line, we're still getting general questions about COVID, what are the symptoms, and, just people asking for general information. And so, obviously we're happy to also provide some of that basic information. That number again is 512-978-8775. 512-978-8775. So if you're uninsured, if you don't have an established provider, and you believe you have symptoms related to COVID-19, then we encourage you to call that hotline, where we have healthcare professionals that can triage you and kind of tell you what's the best course, how to self-isolate and take care of yourself at home, or if it's, critical, if it's more critical than that, either coming into a clinic or even, to a testing site. We have stood up a testing site for the uninsured, and over at the at 41st Street. But, we encourage people to call the hotline first so we can kind of triage you. Again, I think, the goal here is to try to the extent that we can, limit person-to-person contact and address as much as possible, through telephone. And honestly, at this time, we are serving 75% of our patients through telephone, and I'm happy to do so because, as I think Selena mentioned, there is a shortage of personal protective equipment, a national shortage, and we are, in order just to conserve, we have and reduce again person-to-person contact and spread of the virus. We're moving as much as we can to the telephones.
Great. And did I learn that you're also planning on doing, you're learning to do the video?
Yeah, we're on the process of, we're also piloting some video, I guess, appointments. Losing my mind here. So yes, but in terms of our population, individuals who are low income, I think telephone is going to be the best option, unless they have a smartphone or access to the internet, or data, which I realize is sometimes a challenge for our community members. So telephone works fine. We're able to do quite a bit by telephone.
Great. Thank you so much, Perla. And
Sure.
Mariam, do you want to share? No. Oops, did we lose Mariam?
Yeah.
Okay. So I think Mariam's maybe lost her connection, but she's Brave Community's intern, and she also is a pre-med major at UT. So I kind of wanted to invite her to share the next generation's opinions and feelings of COVID right now. But so to the audience, if you have any questions to the panelists, please feel free to chat in the chat box. But I have a few questions, and I'm just gonna maybe popcorn style or ask some of the panelists. I'm gonna start with Sandeep, because Sandeep was kind of my go-to, like 3 or 4 weeks ago when all this started. He was like my go-to personal Dr. MD. So I know right now, we're trying to be physically distant. And we want to, what type of symptoms do you think people should be concerned about to actually go get tested or actually get medical treatment?
I mean, so the symptoms for COVID-19 is variable. First of all, before I go, let me engage the audience. So the coronavirus, the coronavirus has got multiple types of coronavirus. COVID-19 is one of the types. So if you're coronavirus positive, that means you have a common cold probably. But there is a novel coronavirus, which is this COVID-19. So that's absolutely different. So the COVID-19 the major symptoms which you find is fever. That is most common: fever, cough, and shortness of breath. These are the few most common symptoms. Of course, we have seen some diarrhea and some throat pain also coming, also combined with the following three symptoms. Most of the patient, 80% of the patient will have milder symptoms, and it will be okay. Stay home, you're going to be fine. You have to self-quarantine yourself, have a social distancing, and you'll get through it. But there are a few patients who has moderate to severe symptoms, especially with shortness of breath and confusion and severe weakness. Those are the patients we would like to see in the ER, or first of all, call your primary care doctor, get some address, call them before you go to them for testing purposes and all those things. Again, testing is also available, but at the same time, if the symptom is mild enough, what is the testing going to do? You will still self-quarantine yourself for 14 days. So you have to keep that testing for the moderate to severe symptoms patient. So this is a short answer to your question: fever, cough, and shortness of breath. This is like the most pertinent common symptoms seen in COVID-19.
Nice, thanks. And I know we should be practicing physical distance, right? That's kind of a given now. And to keep hospital beds open, and I want to ask maybe LaTashia or Selena, what your take is for what are considered like non-essential medical procedures, and what should we defer until the pandemic is over?
I would say anything that is going to, that kind of comes down to life or death. So if I don't get this procedure done right now, like I literally may die. And again, obviously that's a conversation you would have to have with your doctor to figure out, you know, what lies where, depending on your specific situation. But I mean, honestly, is it worth the risk to put yourself out there to be exposed to something, even if you're already sick or have something else going on? So there are a lot of things that need to be kind of weighed, benefit versus risk. Again, going into a situation knowing that the appropriate level of PPE, you know, isn't necessarily available. Do you want to put yourself at risk for, you know, something that may be even more harmful?
Mm-hmm. And Selena, do you have anything to add? I know, like, I don't know if the Austin or Travis County, if you've been noticing more 911 calls or less, and, you know, any advice to share to the public about calling 911 right now?
So our call volume has actually been a little bit, just a tear either lower or exactly the same. One thing we're not seeing is we're not seeing our weekend call volume shoot up because people are not downtown drinking. And we see people are not getting in as many car accidents because there aren't as many cars out. There are not as many injuries because people just aren't outside as much as they were before. So it's quite surprising that our call volume is actually still steady. What supplanted that is we are actually seeing an uptick in call volumes for respiratory distress and other things that we think are related to people either they're being afraid that they have COVID-19 or actually experiencing some symptoms. So it's definitely been interesting to see how we are dealing with that. We actually created a separate triaging line. So if you have any symptoms that sound like they could be related to COVID-19, you'll actually be sent over to our paramedics that have much higher levels of training on how to triage, and also they can give instructions on if people, even if they think they have COVID-19, if it's appropriate for them to stay home. And they can even make appointments to get tested if they meet the guidelines for getting tested. And so we're trying to divert as many non-emergent calls, especially when it comes to COVID, because, you know, if we take them to the hospital, the chance that they can infect other people that they're around goes up, or if they don't actually have COVID-19, the chance that they could get something else or get COVID-19 by going to the hospital goes up as well. So we're trying to be really smart about the resources that we have.
Mm-hmm. Great, thanks. Actually, let me go back to Tasha, because I know, you know, being pregnant with your second daughter, what resources, you know, or do you have any tips and advice to give expectant mothers right now you know, why they want to like avoid going to the hospitals or going to the clinics or having a medical doctor. So do you have any like personal tips or your experience and any tips for any expectant mothers?
If we're going to be perfectly honest here, I'm a little terrified. And so I don't know if you guys are aware of the statistics with African American women and maternity, like we die more frequently, more often during childbirth. And so just the thought of the possibility of having to go through that without having my husband at my side is absolutely terrifying. And so we've been praying like, Lord, please let this be done by the time, you know, it's time to deliver this child. But it's something that's extremely scary, but, you know, with everything that's going on, it's a possible reality that a lot of hospitals are shutting off, having like a person there with you. So that this may be something that I have to experience alone. And so just kind of preparing my mind for that again, that there's a possibility that may happen. I know for me personally, when I'm getting ready to go to my prenatal appointments, I have one next week, the process looks very different. And so once I'm walking up to the facility, I have someone that like meets you outside and they screen you and ask all these questions. And my doctor has set it up where they are doing what Perla was talking about earlier with the telehealth, to where if it's not emergent, not like life-threatening, they try to do everything online instead of having you come in and expose yourself. There have been stories that have come out that I've read about women. There was a woman recently that died during childbirth who was positive for coronavirus, as well as you've seen stories about the newborns who contracted it as well. And so it's a scary time, you know, and the thing about it is that there's so much that we don't know. And to come out and say, well, this is what it is, or, you know, these are the facts behind it. It's kind of, I think, premature to make those decisions. I think when everything first came out about the coronavirus, we're still trying to figure out how it was transmitted. And so, as you can see, the stories keep changing. And so at this point, it's just, again, terrifying because you don't really know what to expect. As far as resources go, I know that a lot of the insurance companies, I've actually got a call from an insurance company this morning. They're trying to facilitate you staying home. And so they have special hotlines that you can call to get more information, and as well as the clinics. But beyond that, I don't really know what other options are out there.
I wonder if home births and doula services are getting more popular now, or
I've had several friends ask me if that's an option for me. Unfortunately, I had a C-section with my first child, and I'm high risk for a placenta previa right now. And so I've thought about it. I don't know if I would qualify for a home birth, but definitely something that I've considered.
Mm-hmm. Thanks for sharing that.
Mm-hmm.
With as Tasha was saying, like the Black community and especially Black women have a disproportionate level of issues with their pregnancies. This is, you know, it's a systemic oppression through structural racism is real. And so when we think of, you know, seeing the Black disproportionately being affected by COVID right now, it's everything from food deserts to unequal health access to, you know, which causes diabetes and heart diseases, everything, you know, from environmental injustices to housing, you know, that causes asthma. And this is probably, you know, reasons for the disparities in during COVID. Maybe Perla, do you mind speaking, you know, especially because of the work that Central Health does, like, is there advice that we can let the Black and Brown communities, especially in the Central Texas area, know, like, ways to, like, how our community together, like individually, how can they better prepare for COVID, and then as a collective community, on what can we do. And anybody else, if you want to pipe in after Perla, please feel free.
I think it's really our responsibility. I'm not just talking about Central Health, but those of us in communities of color to make sure that we're promoting and educating our family members and our friends about, what the symptoms are, of what the, best practices for hygiene are, pointing them to resources. Here in Travis County, we're lucky to have Central Health and Community Care that can provide services for people who are low income or uninsured. We've got the medical access program, and those who are unemployed or recently unemployed, can call to enroll in MAP, and we are taking applications right now online and by telephone and even by email. And so I'm looking for that number right now. If not, I'll put it on the appointments. Okay. So, looking for that phone number. 512-978-8130. And you can call that number if you need, if you're interested in enrolling, and if you don't have insurance and you're, say you just lost your job, you may be eligible for our local medical access program, and that's 512-978-8130 between 8 a.m. and 5 p.m. Monday through Friday, and they can talk you through, how to enroll. But it's true. I mean, healthcare disparities existed even before COVID-19, before this pandemic, and I think they're becoming even more stark. And I think we're all reading the articles and are concerned. Individuals in the Hispanic and African American community do have multiple comorbidities and chronic diseases, diabetes, heart disease. And I think it's really, at least from the Central Health perspective, is we are aware, and we are paying very close attention, and we're digging through the numbers to make sure that there aren't any healthcare disparities or biases. We do have a high number of people of color that are our patients and medical access program members. So, I mean, that's something that we're paying really close attention to, and we're doing a lot of outreach, not just by social media, but we're phone banking. We are doing mail to our patients, and we're looking at targeting individuals in the African American community, Hispanic community especially, through that outreach, just to make sure that they understand that our services are available. And, if they have a medical issue, a healthcare issue, they should not be afraid to call, and get some assistance from a medical provider. So I think it's just being intentional at outreach, and not assuming that people are going to just automatically call if they have a healthcare issue, and then just tracking those testing, those demographics of who's being tested as well, I think is really important. Mm-hmm. And if there is, some kind of some discrepancies, then, address it. And we are already implementing some, like I mentioned, some targeted outreach to address, to kind of preempt any of that happening.
Great, thank you. Does any other panelists have anything to add to that? I'm going to ask, somebody had asked in a question in the answer box, for community members that are not in need of emergency or critical care, but do need to have a PCP virtual visit in order to refill prescriptions, how are clinics and healthcare providers ensuring that those folks are also prioritized so that they can get their needed prescriptions in a timely manner? And then also many local income community members that are on Medicare, Medicaid, MAP have expressed that it has been difficult for them to get an appointment. Anyone want to answer that?
I can answer that. I can attempt to answer that. So I'm reading here the question that there's some obstacles or some challenges in trying to get visit in order to refill their prescriptions. How are clinics and healthcare providers ensuring that those folks are prioritized? So we do have, initially we were, at least for our population and community care, we were asking people to call our medical appointments line, and that was getting overwhelmed. And so by calls about, COVID-19 concern, and that's why we established a specific COVID-19 hotline for people to call, and so that other folks could, that were calling about non-COVID issues could get through and set up their regular appointments. So for medical appointments at community care, this is for community care patients, they can call 512-978-8015, 512-978-8015. I want to also stress that we do have a curbside pharmacy program, and, we're very committed to ensuring that people have access to their medications. And as a matter of fact, the federal government has allowed for flexibility for insurers, companies, and other providers to provide more than what would be a typical, say, 30-day prescription. They're allowing, I think, for up to 90 days. And so community care patients who need assistance with pharmacy refills, again, this is for, specifically for community care patients, but we do have a phone number for that too, for folks who need assistance with pharmacy refills. So I don't know who this individual is, but she's welcome to call, our pharmacy refill and see if she can get assistance through that. She can call 512-978-8139. This is for pharmacy refills. We do take MAP, Medicare, Medicaid patients. And you can either do a curbside pickup at our Southeast Health and Wellness Center on Montopolis, or at the David Powell Clinic, which is on right off I-35 and like 46th Street. But we can also, we're also, I believe, mailing prescriptions as well. And that phone number again is 512-978-8139. This is for pharmacy refill prescriptions.
I have a question. Perla, I have a question for you. So you guys are also, when you're saying that you're doing the hotline, that is only for the COVID patient and the people who have the regular appointment. Are they coming, they getting fever, temperature screened, and then they're going for the regular appointment? Is that what's happening still, right?
Right, that COVID hotline, the one I mentioned earlier, the 512-978-8775, it's basically a triage line for people who believe they have COVID-like symptoms, or they have concerns that maybe they've come into some contact with somebody who has tested positive or is symptomatic, and they are uninsured and don't have an established provider. We're asking them to call that number. Now, if you do have an established provider and insurance, we encourage you to go through your personal provider. But if, you don't have, insurance or an established provider, call this hotline, and there's going to be someone that will kind of triage you, ask you what symptoms you have, and kind of run through that checklist. And based on that information and other intake information, they'll direct you to the right route. They'll either, tell you to, stay home or self-isolate, or they might send you to go get testing, depending on this, again, on the severity. There's a possibility they could send you to the hospital or, but a lot, and actually we're getting on average right now about 250 phone calls a day. And, I think like 60% of those calls are, really just people asking for information. There's a lot of fear and concern and people, that think they have it, and they might have like a sore throat or something. And so that, obviously our minds jump to, do I have, coronavirus? And so, people call the number, and I think that's fine too. I think we're also there to provide, a level of reassurance and, answer those questions during this time of uncertainty and fear.
Just to add to that resources, we are not a primary care organization. We are an emergency room, but we have also set up called as CASA. We call them, it's a car side assessment center. If you have a COVID-like symptom, you can do like a drive-through and we'll evaluate you. And if you qualify with the symptomology and are at a high risk, we will do the testing. But that's a car side assessment. You don't have to even come in the ER. It's outside in the ER. But again, it's not a primary care office. So I just want to be reiterating that fact for sure. So those are the facilities which we have put together as well. And it is, you can go to our website, austiner.com, and you can find it. We have 4 locations. One is next to Wheatsville in South Lamar. One is next to HEB at Mueller. One is next to Kirby Lane in Anderson Mill. And one is next to HEB at Far West. So we like HEB. So we are around there. So you can use that resources as well again. But thank you, Perla. You guys are doing great thing. I really appreciate what community care does for the organization and for the city and Central Health as well.
Thank you.
Yeah. Again, if you have any questions, feel free to type it in the chat or the questions and answers. Mariam, we didn't get a chance to, I want to have your voice be shared. Thank you for being here. And, again, I hope this as an aspiring, I don't know if you're going to be a medical doctor or something in the medical field, hopefully this panel group is motivating you and inspiring you. But then as a student, like studying this during this global pandemic, would love to hear your feelings, your thinking of, now that you're in it, now that you have to move back home and study online, how this is like, how you and your peers are adjusting to this, and also your takeaway with you being the future potential medical personnel to address things like this.
Yeah, I'm sorry my internet wasn't, I don't know what happened towards the beginning of the call, but because there are so many resources available in the Austin community and throughout Texas, I took it upon myself to see what is specifically for students, and UT is actually going out of its way to help its students through websites, emails, and then the students take it upon themselves even more, and they've created little blogs and little discussion posts where they can help each other in these times of needs. For example, they have a COVID-19 update website where they talk about everything from general updates to things like how to work Zoom links. And they have even resources for employees, like assistance and updates for them so that they don't feel like they are, forgotten about in pursuit of just helping out the students. And then there's a lot of emergency services offered from the school itself, because college students are some of the most vulnerable populations, I think, because they're so financially dependent and oftentimes they're so loan-ridden, so that it can become really overwhelming, especially when most of them are laid off their jobs because they're considered non-essential workers. So UT has gone out of its way and is providing an emergency services fund to where even if you have problems with their internet, you can contact them and ask them for help, because they really want to make sure that every student has an equal chance to learn and get the grades that they would have normally gotten from their home, because they know that not everyone has like a conductive learning environment based on like a case-to-case basis. And then they also send out emails about like midweek check-ins, updating us and keeping us really well informed, where they talk about everything from like health resources, and they even give us like, you know, the UHS nurse advice call line, or like UT Health Austin ways to connect with Austin Public Health or access any form of telehealth, so that we can make sure that we are cared for no matter from where in Texas we are. Like I'm in Houston, my friends are in Dallas, but if, for example, our families maybe couldn't afford our own primary care physician, it is optional for us to get help through the school itself. So I think that's really nice of them. They're really not, you know, leaving us in the dark or leaving us behind or anything. They've also taken it a step further, and they're allowing us to contact the mental health and counseling department if we have any issues with that, because it's a lot of, it's pretty difficult for a lot of kids who are, you know, cooped up in their houses and not being able to see anyone besides their family, or even maybe being on their own, especially when not everyone comes from the perfect ideal home situation. So they're you know, releasing so many mental health resources, ways to connect, ways to talk. And then, like I said, even their employees, they're going out of their way to create assistance programs and keep them informed, communicate with them. And the students themselves, there's one website called Here for UT actually, where kids talk about, you know, academic resources, like how to focus, housing things, because most apartments are still making kids pay full rent, even though nobody is basically allowed on campus, and nobody is essentially, not nobody, but most people are not in Austin due to the fact that it's become like almost a hotbed for the virus. So there are kids talking about ways to help sublease and ways to help maybe get out of your contract, and then just a lot of helpful tips about social distancing, entertainment recommendations, physical and mental health, and things like, you know, workouts and recipes, and just ways for people to feel connected, because a lot of people do freak out about isolation. But I think the biggest help throughout this time has been our professors and our teachers. They are going like out of their way. They're keeping us like, they're communicating with us so amazingly with, you know, like bi-weekly check-ins. They're hosting Zoom meetings, and like they're even, I have one friend who has a professor who offered to buy the entire class a textbook, because a lot of kids can't afford it and have been using it from the libraries before they closed down. I have one teacher who sent out a bunch of links that the UT co-op had suggested for us to look at if we couldn't afford to buy a textbook. And there's websites like Red Shelf and Vital Source Bookshelf that are, you know, literally taking their products that they would normally sell for a profit and making them free to students for the rest of the semester, or the rest of even up until the summer, because online classes are going to go till August now. But overall, there are so many ways that the college has literally gone out of its way to help students, and all of us are really grateful and honestly really impressed, because we don't always have the highest hopes, but it's been really good. I think you're still on mute. I'm not sure.
Thanks for that, Mariam. And then I think Shannon had asked, are the UT online resources available to other young people or other or only UT students? Do you know if is it just available for UT students or other students in Texas and nationwide?
I think a lot of it is actually available to all people everywhere. Mm-hmm. A lot of it obviously would just be like, maybe the textbooks, for example, wouldn't be applicable to everyone everywhere, but a lot of like the call lines and tips that they've offered, I'm sure we could maybe release in a Brave Instagram post or something like that.
Yeah, so Mariam is also our Brave Communities intern, so she helps with the social media and then our newsletter. So we are going to we usually do like a once a month newsletter. We'll create more regular newsletters just to give information for the community. So we'll add that to it, Shannon, and to everyone else. With that, you know, I know right now, I think in the beginning, especially with China, when it originated you know, from Asia where like people were more concerned for older age, you know, victims or people that got affected. But now we're actually seeing in the States and Europe that it's more younger people. So I don't know if anyone wants to share. I know Sandeep has his 2 cents on like everybody. I mean, when the last time I saw you in person, you're like, get away from me. Like, everyone has to wash their hands and like go under your fingernails. But if there's any advice, especially to, I know, like students or the millennials, the age group that's really being, that like we didn't originally think that, you know, the young people, they're healthy. Do we have any words of wisdom and advice to kind of, you know, stop the spread?
Can I take this question? So, first of all, take it seriously. That's my goal for everybody. Take it seriously. It is real. You know, some people had asked me as well, is it real or not? And there are a lot of myths around it, especially with young people, you know, young age group. They think that this does not affect them. It affects only elderlies, you know, and geriatric patients and all those things. But let me geek out a little bit here, drop some data, you know. So, I mean, Travis County itself, do you know, Travis County itself, age 20 to 39, the people who are affected in Travis County is around like 597 people as of yesterday. And there are 7 deaths. Out of which the people affected in Travis County, 45% are from 20 to 39 years of age. So that's young. If you add 50 to 59, it becomes 65%. So the young people and young adults are significant. Of course, they're a significant part of the Austin community, but still, that's a fact. That fact remains fact. This many people are affected, so it definitely affects young people as well. So the first thing is take it seriously. Second thing, follow the norms. Follow the social distancing. It's okay if you don't go out and party. It's okay if we don't get together. You know, this is the best medium to get together as of now. Hand hygiene, you know, 20 seconds of hand washing, mask if needed. Social distancing is the best thing, and stay home. Lockdown. That is the one most important thing which has definitely helped in the surge. So the recent study had showed like the surge in Austin should be like almost now, but it has been pushed on for 2 weeks now, just because of social distancing. That's because of we are locked down. Just because we are taking the precautions and the measure, it is affecting, it is helping. It is definitely helping. So those are the things. First of all, take it seriously. Second of all, social distancing, wash your hands. Third, try to find different hobbies rather than going out. So,
yeah, thank you. And yes,
I'd like to add something to that. And so just kind of going back to what I was talking about earlier, how they call it the novel coronavirus, and that's because it's new. There is so much information that we don't know about it. And so, you know, when you're thinking about what kind of situation you want to put yourself in, you don't want to be a statistic. Like, you don't want to put yourself in a situation to where we're finding out new things based on the information that's having to come out. And so, again, when it first came out, they were saying, oh yeah, no, it's older people. And it's like, oh, actually, now that we're 3 weeks in, we see that that's not the case. And so, again, there's so much that we don't know that we're learning every day. But the data is showing that, you know, what we thought we knew 3 weeks ago, you know, is non-existent information now. So it is very imperative that you do take this seriously, again, because there's so much that we don't know about it.
Right. Thank you for that.
Just to add to it, that is absolutely correct. And the things which I talked a week ago was we made changes in the organization does not matter anymore because the things have moved in totally different direction. Things are moving so fast. People are saying summer is here, everything's going to be okay. Oh, great. Could be. But we don't know that for a fact. So we can't take assumptions and then we can trigger out the number of cases, increase incidence rate. And that would be, again, a second big problem. So we don't want to be in those situations.
I remember at the very beginning, they were saying, oh, for whatever reason, African-American people aren't really getting it. They're immune. And all of a sudden you see the stories coming out going, oh, African-American people are actually dying the most. What's going on here? So again, you don't want to put yourself in a situation because you're relying on information that, you know, may or may not be accurate, only to find out after the fact that that wasn't the case at all.
Whenever they say that African people don't get it, I say Idris Elba has it.
That who has it?
Is Idris Elba? Never mind. The actor, the James Bond actor who would be.
Okay.
Seriously, Emily, come on now. Sexiest man alive, like where have you been? Come on.
Sorry. So Selena, I know that the EMS came out with a like demonstration of how to put on face masks and take off things. And if you can share that, I want to like value our time right now. Maybe we can share that too and distribute that social media wise in our newsletter. But then with PPE, you know, like now PPE resources are needed for the medical facilities, but CDC is also recommending people to wear it in public. So can you clarify, you know, should people be wearing masks? You know, what's the recommendation? Can these masks be washed or reused? If you have any insight on that, that would be helpful.
Sandeep might also be some help on this. It's kind of hard as a medical provider because there really isn't that much great evidence about certain types of cloth fabrics as actually protecting people from particulate matter and filtering out particulate matter. I know that, you know, the New York Times and a lot of other places have put out stories about what types of fabrics are better as face coverings. We're having a big internal struggle within EMS also about, you know, what is the right covering to wear, just going on regular calls, going on calls where we suspect a flu-like illness or COVID. I know in the hospitals, there's a huge struggle as well. As a nurse, I'm issued one surgical mask a shift. And I know that we have other people that work at Ascension on the call, but there's been some negative press about ER physicians that want to wear N95s during the shift. And I know that gets, you know, real about the limitations and the supply chains that we have. But the CDC says wear a cloth covering mask. We're trying to figure out if we're going to have our medics do that, which our city manager, Spencer Cronk, just issued guidance that all city employees also need to be wearing cloth masks. The fire department has issued guidance that all firefighters need to be wearing a surgical mask at all times. And EMS has issued the same thing. We want to make sure that that is actually filtering out particulate matter. And so we're considering looking at different types of masks that are reusable that we can buy. I think it's too hard to say what is washable versus what is not washable. I've seen photos of people trying to microwave surgical masks and then they become black puddles of mess. Obviously, if it's a cloth mask, you can certainly wash it. There's also evidence that shows that if you put anything moist on the face mask, that it reduces its efficacy. So it's definitely a very difficult issue that I think all health providers are still grappling with. As far as what we call don and doffing PPE, so putting on and taking off PPE, the biggest thing to remember is don't touch the actual front part of any mask. Because you're actually, you know, sucking in air and sucking in particulate matter. So the front of the mask is going to be the dirtiest part. And so try to only touch the loops. So if you're wearing an N95, you only want to touch the two loops. If you're wearing a surgical mask or a cloth mask that you've made, you only want to touch the ear loops. We also highly recommend washing your hands before and after, or at minimum using hand sanitizer before you take off the mask, before you put on the mask, and after you put on the mask and after you take off the mask. So sorry for the kind of nerdy ramble about PPE before, but that's some basic guidance is don't touch the front of the mask and take it off by the loops and use hand sanitizer or washing your hands before and after you take on and take off the mask.
Great, thank you. Thank you.
I agree with Selena a great deal. One of the things which I want everybody to understand, the CDC has put out to wear the cloth mask for everybody is to prevent from them to go to the other people, not the other way around. So first of all, a little basic. There are multiple phases of this disease. If you have disease for 6.6 days, you will be asymptomatic. You will not have symptoms. So the mask when you wear, or the cloth mask, or whatever the recommendation is suggestions are, so that when you go out in the public places, first of all, don't go out. Second of all, if you're going out, when you're wearing the mask, so if you have the disease, if you're in the asymptomatic phase, you will not be able to pass on from you to other, not from other to you. And if you have symptoms, why are you going out? Stay home. So that should be the whole answer, stay home. So this is why they have put together. And again, so before the, the shelter in place and lockdown or stay home or all the hashtags came, the whole thing was this disease. One person was spread, the R0 we call them in epidemiology is 2.2. That means one person will spread it to 2.2 people. Suddenly, if you have the people not going out, suddenly you are flattening the curve because that 2.2 have decreased to 1.2. So suddenly the infectivity, how many people you're going to infect, has decreased. That's why you don't getting the surge right away. It's taking a while so that you can gear up to whatever, you can do the preparedness which is needed. So those are the things. That's why we keep on asking everybody, why are you out? You know, why are you going out? Why can't you just stay in? Finish your Netflix, guys. That's where I'm come from.
Okay, I know we have about 3 or 4 minutes. So I want to, like, along with that. So when you do have to go out, leave your house for work, that's an essential work or something, what should you do when you come back? This is a question from one of the audience. What should you do when you come back home to protect your families? And another question is, like, what about shoes? We've heard, like, sometimes can COVID-19 be transmitted in our shoes? So, like, if and when someone goes out, and when you return back, what should you do to protect your family and your loved ones?
I know medics are in a little bit of a different category, but it goes the same for nurses as well. And I think it could go the same for essential workers and all essential workers, and probably should. We obviously deal with people that we know have COVID or we suspect have COVID-19. But how we do it is we leave all work shoes outside the house. We also are encouraging our folks to change out of their uniform before they even get into their car. And so work shoes can either stay at work or stay in the car somewhere in a bag. So we're actually encouraging our folks to bag up all of their work uniform before they leave, and then change into plain clothes, go home, immediately deposit that stuff into your laundry facility, and then take a shower. So that's what we're encouraging our medics to do.
And what about, like, if people are taking walks around their neighborhood, not at the parks this weekend because they're all closed this weekend until Monday, but you know, if you're taking a walk in the neighborhood or you're running in and going to HEB, is that a precaution? Should you have to do the same? Do you recommend the same precaution?
Highly encourage everybody to use Favor, and HEB has free curbside right now. If you do have to go inside somewhere, take good hand sanitizing precautions. Make sure you wash your hands really good when you get home. But I mean, if you still want to be very cautious, you can always change your clothes again. We all have a lot of time on our hands now, and so I'm sure you can handle an extra load of laundry. But people do have, like, outside of the house, these are the clothes I wear, and inside of the house, these are the clothes that I wear.
And
Selena, I'm sure that advice could apply to, like, grocery store workers and other, you know, essential employees that are still, you know, doing the day-to-day work that we depend on. I know there was a question in the chat box about that, but, you know, we can't stress enough to wash your hands and limit touching of the face.
yes, don't touch your face. Simple.
Yeah.
No. So actually what you can also do is in your house, in a hallway area, you can mark with paint tape, dirty area and clean area. You don't cross that line. You take out your shoes over there, and then you have a basket, a laundry basket over there. So you take off your clothes and you go, and the good part is the detergent definitely kills it. So that is good. Laundry helps. you know? So those are the ritual you have to come up with. This is going to be a normal for a long time now. So we have to kind of adapt that habit, not wearing shoes in the house, keeping it outside, or maybe having a clean area of the house and the dirty area of the house, using hand sanitizer as much as you can, and forget about it. No, if you don't get hand sanitizer, soap is a very good option as well. So use that.
Right. All right. I want to thank you all so much. I want to honor all of your time. I know you all are so busy, but there is a question, Gokwe, on the questions and answer. If any of the medical specialists can answer that, that would be wonderful. In the board. Before we leave, if there's anything, I know so many of you, not only are you just serving the community in your professional field, but then you're also are such philanthropic and altruistic people in general. What either your organization, your clinic, or organizations that you are working with, what your needs are, so that we can ask the collective community to help, whether it's, you know, whatever needs that you may need. Does anyone want to share or start?
I can say that there is a shortage of personal protective equipment, specifically masks, and we at community care health centers are doing all that we can to work with vendors and members of the community to obtain masks. Selena, I'm sure you guys are too. Right now, you know, the EOC is collecting masks, but it is going to like emergency responders and hospitals who are like even more so at the forefront of you know, and seeing the sickest, you know, high risk individuals. But you know, we are taking donations of masks, and you know, I'm happy to share a contact with you, Emlyn, if there's anybody who has access to. I know there's been some folks in the community that have received shipments from family members abroad, and we appreciate that.
Great. Thanks. Yeah, I think I know the Austin Chinese American Network. I think they've donated some, and I think another shipment is coming.
And we have received donations.
Great. And I think, okay, great.
From them, yeah.
Shout out to Aiken. Anybody else?
There was a question in the chat about can you get COVID-19 again? And I will also defer to Sandeep. But my understanding is that a COVID-19 infection, once you are recovered, so we had a medic who had COVID-19. A lot of people have asked, why isn't she getting another test? We know even at 2 weeks outside of the symptoms, you could still potentially have a positive COVID-19 test, but that doesn't mean that you are infectious. And so the CDC has said after 2 weeks, a healthcare professional can go back to work. They've even said 1 week, as long as you're not working with immunocompromised people. Our medics are, so we're saying 2 weeks. And because of the similarities to influenza, we assume that it gives you about a 1 to 2 year immunity from getting another COVID-19 infection. But that is always changing. We obviously haven't had COVID-19 for 1 to 2 years, so we don't actually know. It's just based on the similarities to influenza, but maybe Sandeep has read more recent literature than I have on it, and I'll let him answer.
Well, I mean, it's pretty similar to what you said. So it does not, so we don't have like exact data whether you can get second time in the same season or not. So here's the deal. If it's going to be like influenza, then we'll have vaccine and we'll have one more vaccine for rest of our life every year. That's how it's going to be. But if it does not mutate in such a way that slight mutation that we need a vaccine every year, then once you have that, you'll have antibodies in your body, IgG, and that is going to remain in your body for a long time. So if you test it, the antibodies will make it present. But when you test it again in like 3-4 months from now, it will not be positive because the antigen is not going to be there. So just medical geek stuff. But short answer to this question is we don't know a lot of things yet.
Are there any other asks or comments? I just want to look at you all right now and not hang up because I haven't seen you in so long. Perla and Tasha and I were in a small group together with Greater, like, what, 9 years ago. So it's so great to see all of us together.
I know, it's like Perla.
Shout out to Greater Mount Zion.
Yes, great to see you guys too. All your beautiful faces.
One more thing. So I'm helping the Asian American Network to put a database together for the people who needs N95 and the surgical mask. So Emlyn, whenever you possible after this, you can send out the link and the need assessment form. So we're just collecting data as of now. And once it is done, we might be able to see what the committee is going to decide how they want to distribute it and all. So, but we are working with this Asian American task force. They are very vigilant about it. So.
Great. And I know that Community Resilience Trust Group is also have a community assessment survey. So we can share that on our social media and then also newsletter. So thank you all so much. Thank you, panelists, and thank you to all the attendees. And then please, join, follow our social media, which is Brave Communities on Facebook and Instagram. And then we will most likely send out more